who do not actively visit facilities are still reached. In addition to these community-based activities, we have made preparations to support a thoughtful, well-planned integration of school clinics and community pharmacies as service delivery points. We want to take our time to do this within this year, but first, we will take our time to learn how to go about the integration in a responsible manner. So we're not going to do a wholesale. We are taking our time to track the progress and then to smoothen the edges. So the big question is, what is changing? What is changing is that care will no longer depend on when you become seriously ill. Instead, care begins earlier. Screening becomes routine. Health workers engage communities proactively, and the system shifts from reacting to illness to preventing it. So from sick care to health care. Because unlike we used to do, where this was left to chance, now we'll pay for the health workers to do this, and we will equip them with kits to do exactly that. Now let me speak to implementation. This policy has not been rushed. It has been carefully designed over the past year and further improved based on input from cross-section of stakeholders. So we've consulted widely the Ghana Medical Association, the media, our partners. We've engaged widely, members of parliament, everybody has been taken on board. Ladies and gentlemen, let me assure you that the policy is for the nation. What we will do is to implement it in phases between 2026 and 2028. We will begin with 150 selected districts, particularly those that are underserved, and then expand nationwide by 2028. So it's going to be phased out. We are going to start with 150 districts out of the 261. And we are going to select districts, underserved districts in every region. Every region will look at the underserved district and will phase it out. At the end of the day, the ultimate aim is to get the whole country covered. But we have to, from experience, we have to roll it out in phases so that we'll learn from the shortcomings and smoothing the edges. This phase approach will allow us to learn, adjust, and ensure that quality and sustainability are maintained. Ladies and gentlemen, we are ready for implementation. Prior to Wednesday's launch, which will be done by His Excellency the President of the Republic of Ghana, President John Dramani Mahama, significant preparation has already taken place. We have mapped the services delivery point, and referral systems have been defined. Indeed, the government has taken concrete practical steps to ensure that free primary health care is not only announced, but will be delivered efficiently and effectively. In preparation for implementation, we have procured and are ready to deploy 24,534 pieces of essential medical equipment across the country. This is intended to ensure our facilities and health workers are equipped and ready for implementation. I've already indicated the equipment status of our health facilities in the country. So we can't just be announcing policies without preparing. So we need to retool our health facilities to properly equip them to face what is ahead of us. This includes critical items such as incubators to support neonatal care, glucometers to enable routine screening and management of diabetes, hospital beds to improve patient care capacity, and ultrasound machines to enhance diagnostic services, particularly for maternal health. Over the next 2 months, Ghanaians will begin to see this transformation in action. We will distribute equipment to all the 150 districts that will be part of the first phase of implementation. We will intensify community sensitization through town halls and engagement. We will deploy trained volunteers to support our community health workforce. We will establish over 350 container-based service delivery points in high-traffic areas such as, markets and lorry parks. Very soon, health workers and volunteers will not only be waiting at facilities, they will be in your homes, schools, churches, and workplaces, screening, educating, and supporting you to stay healthy rather than treating you. Ladies and gentlemen, these investments are part of a broader effort to equip frontline facilities, especially CHIPS compound and health centers, with the tools they need to provide timely quality care. It is a clear demonstration that this policy is backed not just by commitment, but by real resources, careful planning, and a determination to ensure that every Ghanaian can access effective primary health care services, not rhetorics. We are also strengthening the digital system needed to support tracking and accountability. Financing mechanisms have been aligned and the budget fully integrated in the National Health Insurance budget. And at this point, let me inform you that we are not going to reinvent the wheel. We are not going to set up any bureaucratic steps for the financing scheme. The financing is going to be done by our National Health Insurance scheme. And this is as a result of the uncapping of the National Health Insurance that His Excellency the President, did in his first term. This is a good time to address financing, which I'm sure you'll be interested in. Budgetary provisions have been made for implementation in 2026 allocation to the National Health Insurance formula. So every year, the National Health Insurance formula goes to Parliament, and in the 2026 formula, an allocation for free primary health care is secured. So there is no issue about costing. We've done all our projections, how much it will cost us, and we are on safe grounds. We'll use a hybrid model to support payment for the services provided. Preventive and promotive services will be financed through population-based payments, whilst curative services will continue to be reimbursed through the National Health Insurance scheme. It is important to emphasize how this sits within a broader set of reforms on how we finance healthcare in Ghana. And our reforms and our initiatives, policies, are comprehensive. One complements the other. And so you will hear the uncapping of the National Health Insurance by the government to create more physical space, and the establishment of the Ghana Medical Trust Fund to support advanced care for the chronic conditions. And I've seen the administrator for Mahama Cares also here. So what we are building is a complete system. You cannot invest in treating complications while the complications keeps dropping in. They will drain your resources. So what we are moving to is to check the source and kill the disease right there, so that if, in any case, there are some that we are unable to prevent, if it gets to its complication level or state, then Mahama Care will also be there to save you. So what we are building is a complete system from prevention to treatment, specialized care. This is governance. This is what the pathway to health sovereignty looks like under a responsible government and a responsible president. As we all know, His Excellency the President has been championing the health sovereignty since he assumed office. And it's not only in Ghana, across the continent, on the globe. And they say charity begins at home. So he is demonstrating it right here in Ghana. At this point, let me also emphasize that this policy fulfills a promise. This government committed to expanding access to healthcare and removing financial barriers at the primary level. Today, we are delivering on that promise. We are also putting strong accountability systems in place. We will track service delivery, monitor quality, measure citizen satisfaction, and ensure that resources are used effectively. Citizens will have channels to provide feedback and report challenges, because this system must work and it must be seen to work. Let me now conclude. This policy is about changing outcomes. It's about ensuring that Ghanaians do not wait until they are seriously ill before seeking health care. It's about ensuring that diseases are detected early. It's about reducing avoidable illness. It's about reducing preventable death and improving health of our population. Ladies and gentlemen, to the people of Ghana, my message is simple. Let us use the services and use them responsibly. Go early, get screened, because the system is being built for you. It is built for all of us. Ladies and gentlemen, free primary health care is not just a policy. It is a reset towards prevention, a reset towards equity, a reset towards a stronger and more resilient Ghana. And this government is delivering on its promises. I thank you very much for the opportunity.
All right. Thank you very much, Honorable Minister, for that briefing. So the floor is now open for questions from members of the media present. And as is the usual rubric, we'll call on you to line up to my left behind the microphone. Introduce yourself, the media house that you work for, and then proceed straight to ask your question without lengthy preambles, so that we can save time. So anyone who has a question can go to my left here and ask it.
Hello. Okay. Minister, my name is Abdul Hanan Adam, and I work with EIB Network. My question is that a few weeks ago, the country was discussing issues relating to health and no bed syndrome. I just want to find out from you, how does this policy some way, somehow address this particular phenomenon? Have we made any provision to tackle this particular challenge? Thank you.
All right. If there are any more questions, I would invite you to ask them now.
Komla Kluche, I work at TV3. Whilst at this, you have indicated that the budgeting has been linked to the National Health Insurance Scheme, but many would equally ask, has the government costed how much it will cost the taxpayer per month in terms of the free primary health care? The question is, how much is it going to cost the taxpayer per month? Two, since 2024, a lot of drugs or donations from the UNFPA have been held up at the port, and concerns have been raised by the UNFPA itself over Ghana's inability to clear them. What is the challenge? Since 2024, we've not been able to clear this, and I believe that, some of these things would equally go to help in the provision of the free health care. What is the challenge with respect to the clearance of these drugs at the port?
All right, thank you very much. Are there any more questions, please? All right, so let's so please, if there are any more questions, line up right behind it so that we save on time in terms of the transition. Please
okay,
go ahead, yeah.
I'm Akosi Autre. I correspond for City FM Channel 1 TV. So, Minister, your government says that this will be a game changer, but analysts are also warning that if it is not structured properly, it's going to be a system strainer. My question has got to do with brain drain in the country. We know hundreds and per data, hundreds of nurses and midwives who are leaving the country. And then you say that you want to use community nurses to implement this policy. my question is, you know that these people are not leaving the country because of just jobs that they don't have, but low salaries, and also they say poor working conditions and inadequate infrastructure. How are you going to ensure that you get all these people to come on board, that's nurses to come on board to, administer these, free primary health care? Secondly, my question has got to do with the chip compounds. I know that some, at least the PRO yesterday spoke to City News and indicated that some centers are being constructed. We know that 30 of them in Medina area is being constructed to help this free primary health care. My question is, some chip compounds are not, adequately equipped. Why are we building more chip compounds or health centers to help this free primary health care?
All right, that is fine. So we'll take the last question in this batch.
My name is Wisdom Hedejum. I work with TVXYZ. Now, talking about monitoring and deliverables, would there be sanctions for persons who maybe seem to be sabotaging the processes? And then again, will this medium come with medication, and how different is it going to be from the NHI? And then finally, is there going to be a sort of legislation to back it? Because policies may come, a new government may come and say, we don't want this again. Would that be a policy implementation?
All right, thank you very much. So the minister would answer these questions. Thank you.
Good. Thank you very much for all the questions you have asked. Before I touch on the questions, as I have already indicated, this is not about even the freeness of the service delivery. It's about the attempt to reset our health care system. The freeness is important, but it's also important to reflect on how our health system has been over the years. And so this is going to touch on every aspect of our health system in the country. There are people who boast and pride themselves that, oh, maybe I may call a hospital that if you say, oh, me, I may call a hospital that. That is not something to boast of. Every human being must be visiting the facilities at one point or the other. At least, you must be doing a routine checkup. At least. So this is a system we are designing to. So by the time on-call hospital that now so one year done, by the time obey are no cool. So this is exactly what we are doing. Now, questions about no bed syndrome. So this is an attempt to even detect those conditions that will rush you into emergencies on time. It's an attempt to detect them and to even prevent them before you even get the emergency for them to tell you there's no bed. So it has a direct link. There's other systems we are putting in place to address the no bed syndrome. But no matter the number of beds you will increase, if you don't prevent the disease itself, we can't have enough for the no bed syndrome. So there's a direct linkage. And we are tackling, a lot more on the no bed syndrome, looking at increasing the beds, using the IT to have visibility on the number of beds we have at our regional level, regional hospitals, our teaching hospitals. So when I'm in my office, I know the empty beds in Rich, I know the empty beds in Kolebu. We are doing that. We are setting up a command center using the IT. So every regional hospital will have commanders who will feed into the system. We are doing that. We are looking at having another emergency center in addition to what we have in Accra. The Kolebus and the UGMCs and what have you. We are doing all that. So that's another leg of it we'll have. But this has a direct correlation. When we are building a health system, it must be comprehensive, not to start from a point. Yes, the costing. Yes, we've done the costing, and we need not less than 1.2 billion Ghana cedis a year to be able to run this. So we've done the costing. So if you want by much, you can divide by 12 and you get a figure. So it's not an ad hoc program or project. We've thought through it. We've engaged widely. We've done our projections, and we know what we are doing. Now, the issue about lock-up containers at the port. You all know my position on those things. And so since I took office as a minister responsible, you can find out. This is the first time you are hearing of a container being locked at the port uncleared. And that was somewhere in 2024. But unfortunately, this beat my radar. And so I thought it had already been cleared. And so the officer in charge has even been queried, because he hit a snag and he was supposed to come back to me. And I always tell my directors, when I give you a responsibility and you hit a rock, please come back. And then, but the good news is that the action has been expedited on it for the clearing of it. And I can assure the country that we'll do whatever it takes, because we want more donations. And once they come and it comes to my attention, we'll clear them on time. So anybody at all listening to me, if you want to bring us Ghana, some items, you just need to come and consult the ministry, and you consign it to the ministry. Once you consign it to the ministry and they come, we will clear them for you. So this is, I think, the first case I've heard of since I assumed office as a minister, and we'll expedite action on it. Issues of brain drain and poor conditions, whether we'll have health professionals to do this. The problem we have in Ghana is not availability of health professionals. That's not our problem. So, by the grace of God, we have enough in the system who will help us to run this system. In fact, it's even a deliberate policy to even assist and facilitate some of them to even go and work outside the country. So our problem is not about the availability of health workers. That is not our problem. So we never even reflected on that, because it's not our problem. If it is not broken, you don't fix it. So it's not something we must contemplate on. So you realize that from time to time, and one of my PAs came to show me a video about somebody who was accusing me that I had said we wanted a space to employ before we can employ. You realize that from time to time, government facilitates some people to leave the country. So they create physical space, not vacancies. So the space here is not a vacancy. It's a physical space. Because look, the truth of the matter is that we can only employ what we can pay. It's not as though we don't have the vacancies, but we have a country to govern at the end of the day. So if I go and sit in cabinet and I say, oh, I need free primary health care, then they give me. I want to recruit health professors, then they will give me. I need Mahama cares, then they will give you. Regional hospitals, they will give you. Why? Am I the only ministry? No. So at some point in time, we have a country to govern, and that is a reality. You may not be happy with it, but I'm sorry, that's a reality. And so brain drain, yes, we need our professionals in the system. We'll continue to train more. We'll continue to create the broader economic atmosphere which goes beyond the health sector. It goes beyond the health sector. By the grace of God, our economy is not stable. So instability of an economy cannot be used as a reason to leave this country. We had instances where people were giving haircuts. So that was enough reason to leave this country. By the grace of God, it's no more the case at the moment. So we'll continue to do our best. The issue of we don't have equipment in some chips and we are buying more and we are building more. The question or the answer should be deliberate effort to retool those ones, not those who don't have must also continue to have. We are preaching accessibility, access to healthcare. And so there is that deliberate effort. I've already indicated that our equipment status in our health facilities is not the best. So I've mentioned clearly what we are doing to fix that problem in my speech, buying more, bringing more kits, and to solve that problem. So we should be able to expand to those places where there are none. And by the grace of God, His Excellency the President has instructed every district to build at least 2 chips compound. So we are growing. So we'll continue to build more, but we'll continue to also equip them. We may not have the maximum, but we'll do our best. Then sanctions for people who sabotage the system. Interesting. I just met my regional directors in my office today. Right from there, I joined you for this encounter. So everybody's on board. They've committed. They've pledged their support. And I pray nobody sabotages this system. If you sabotage it, you sabotage yourself. I can assure you. Appropriate legislations. Yes, we've made the appropriate legislations. And you see, the issue is not whether or not a government will come and scrap it. The issue is whether or not Ghanaians have accepted it and they know it's beneficial to them. Has anybody scrapped national health insurance? Has anybody scrapped free SHS? So if we accept it, if it is working, if we are getting the results and it's working for all of us, no government will have that gut to even scrap it. We serve you. Now, the difference between the free primary health care and the national health insurance, I've already indicated clearly. The free primary health care will include curative. I mentioned it in my speech. Some malaria, some minor procedures, malaria, diarrhea, respiratory infections, and all that. And the preventive and promotive, where you see the volunteers with their bags at their back and walking into people's homes, debtors and what have you. That is different. But the national health insurance will go beyond the free primary health care package. So when you are sick and you go to the primary health care facility and you are referred to, let's say, a regional hospital, you cannot go and say because there's free primary health care, they should take care of you free of charge. It will not happen. And it is about time we get to know these boundaries clearly. Nobody is ready to give any false hope. So that is why it is important. In order for you as a Ghanaian to have that comprehensive protection, it is important to complement this one with national health insurance so that you will be a subscriber. So please, in the matter of 1 year, we inherited the national health insurance coverage at around, Dr. Bampo is here, around 57, right? Around 57%. But in a matter of 1 year, we now stand at 66%. So we are not leaving any angle, any sector of the health sector behind. We are working simultaneously, whether it's FDI, FDA, or the Ghana Health Service, or Vaccine Institute, or regional hospitals, or teaching. Everybody, you must move. That's what we are doing in that ministry. And everybody is on board. You can see all the directors. So if it's about free primary health care, although it's not about Mahama Cares, but you see Mahama Cares here, it's one ministry. Anyway, so that is the difference. Thank you very much. Any more questions?
So, Minister, I think my question has to do with, I'm following up with my earlier question.
No problem.
It has to do with if there were immediate steps being taken to ensure expansion and bringing in more beds, especially at the various emergency centers.
Talking about the no bed syndrome.
Yes.
Okay.
Yes.
So no more the linkage, but what we have done, the measures, no problem. I'll answer that.
Okay.
I thought it was a linkage between this one and this, but I'll answer that one.
Yes. So the first one was the linkage, but
the second one is what we have done so far.
Yes, exactly.
No problem.
So I have another question, especially when you are talking about building of additional chief compounds across the country. The former president, His Excellency Nana Addo Dankwa Akufo-Addo, I see you smiling. Whilst Nchebi says that your government should try as much as possible to complete the Agenda 111 projects that he started. How do you respond to his query to your government? And secondly, Tamale, the Tamale Regional Hospital, there are concerns that on paper it is a regional hospital. Previously it was Tamale Central Hospital, but now it is Tamale Regional Hospital, the Northern Regional Hospital. There are concerns that it is not up to standard, that there were plans or moves from 2023 and 2024 for the project to begin with support from JICA, but it appears it has halted. Has this come to your attention, and what are you doing about it? Thank you.
Thank you. My favorite questioner.
Minister, tomorrow is going to be exactly 1 month since you said you were going to chair the committee that's going to investigate the death of the hit-and-run victim, Charles Imisa. I want to find out from you, what is the update on the investigation?
Good. So can I respond to these ones? Okay.
Hello, my name is Belinda Annan Kwanta, and I'm with Wezo TV.
Now, Minister, you mentioned that only a small percentage of facilities currently have full basic equipment. So I want to know, how will you guarantee that people in undeserved communities receive the same quality of free care?
Underserved communities.
Yeah. Sorry, underserved communities receive the same quality of free care as those in the well-equipped areas during the rollouts? And then also, what specific systems will be in place for citizens to report challenges, and how quickly will your ministry respond if services promised under free primary health care are not delivered? Thank you.
Good. Thank you very much for these questions. No bed syndrome. I tried to tell you what we have done so far. So if you remember, I said we're going to use the IT to monitor the beds. What we are doing at the moment is counting of the beds and barcoding the beds. We are creating the center at Rich Hospital. That's where we are creating the center. So that is one aspect. We are going to go to Parliament for legislation on emergency issues. We are looking at adding more beds to the already existing health facilities, and we are also looking at establishing a whole facility to add up to the emergency services, and that will be located around the Bema camp area. So there are a lot we are doing. When the report comes up, they will come up with some recommendations, and we will implement them to the latter. So a lot is being done with respect to that. The former president, I wish he never said this. I wish he never said this. Unfortunately, he has said it. He told all of us that Agenda 111 will be completed before he leaves office. Let me even grant him the longer period he gave, that he will complete all Agenda 111, all the 111 hospitals before he leaves office. And by the time he left office, he had expended 4.8 billion Ghana cedis in Agenda 111, and not a single one of them was in operation. So this is the person calling us to complete Agenda 111. But let me tell you the good news. His Excellency the President has instructed that no project that he has inherited should be left to rot, should be left unattended to. So Agenda 111, we will continue Agenda 111 and we will finish Agenda 111. We will put every person invested in this project to good use. So if you read the 2026 budget, it was clearly stated in it that this year we are going to finish about 10. And we may even finish more, I can assure you. And this time, we are planning to see how we are not behaving like they behaved. We are planning. So we'll look for the source of funding. Even if they had planned, the 4.8 billion could have completed about 20 and roll out the next one. So now we are planning to see where government can come in to finish. Where CHAG, the Tayeboa is here, the Christian Health Association of Ghana, they are our partners. We are not into competition with them. Can you also come in to pick some of them, finish, equip, and run? The private sector, where do you come in? So we are planning a lot of thoughts going into this. Please. Now, the issue of Tamale Regional Hospital. Yes, Tamale Regional Hospital, we have, I think, a bilateral with the Japanese government. And over the years, it came to a halt, but we have reactivated our relationship with them. The bilateral has been signed. They've told us their challenges. And quite recently, if you saw me in Japan, it was one of the issues for discussion. And very soon, they will report to site for the continuity of that project. So it is true. Very soon. Now, the issue of my late brother Charles. The committee was set up that was chaired by Professor Bedu Akosa, and I have been hinted that the report is almost ready. And, this week will be full of free primary health care. So very soon, I'll make the findings and the report public. And we will not hesitate. I know some people will not be happy, but I'll say it. We will not hesitate to implement the recommendations to the latter. So I will end that one there. How people in underserved areas will have quality health care. I've already said that, and I'll say and I'll repeat it again. That is why we just didn't come here to announce the policy. Somebody will say, show working. We have shown you what we are doing. And about a couple of days ago, myself and my brother Felix visited a whole lot of a warehouse full of equipment. And that is not all. It's about 24,000 pieces of different essential equipment. So we equip, and we've told you that our target is underserved areas. So we equip those places. When I took office as a minister, we realized that there were some districts without medical doctors in this country. It should be a thing of the past. And we insisted that our medical officers who were posting should go to the districts, not check compounds, not health centers, not polyclinics, but district hospitals. By the grace of God, in 2024, we have a record where about 8 underserved regions had only 12 medical doctors. 12 medical doctors. Not one regional, the whole 8 regions. The OT, the Western North, the Northeast, and they had only 12. 1, 2, 3, 4, 5, 12 medical doctors in 2024. But in 2025, in our posting, we are not done. But we are hitting 100 for those same 8 regions. 100. And we are not done. And immediately after the free primary health care launch, those who didn't accept the posting will be deprived of those postings and will open up. So even if the medical doctor qualified yesterday, we'll post him there. Sometimes, as a leader, you don't have to take popular decisions all the time. You must swallow the bitter pill. Social media. So thank you very much for the opportunity for these questions. If there are more questions, I'm happy and prepared to take them. Which one? Underserved areas?
No, I asked what specific systems will be in place for
monitoring.
Yes.
Yes. So this we are setting up. You see, the implementing agencies will be CHAG, Ghana Health Service, the private sector, and I even said that, you know, in our manifesto, we promised that we're going to convert the sick base into clinics. So this is a concept, but we are taking our time to roll them on gradually. We are going to bring the community pharmacies also on board, but we are taking our time. So they will have monitoring system, and at the ministry, we have a central point where we are monitoring Mahama Cares, we are monitoring the government flagship projects. You know, so we'll have a monitoring system that we'll use in monitoring. And I've told them today, I met the regional directors and I told them that, look, we are going to reward hard work. So every policy we are rolling out, we must be able to measure the impact, not just policy. So when you are a region or a district and you are giving us the results, you must be rewarded accordingly. And we have a whole backlog of health professionals. Now, if you go to a place like Kenya, we traveled to Kenya to see what they were doing there. Kenya, yes, they have the voluntary system, but unfortunately for them, they don't have their volunteers as health professionals. But we in Ghana, we will take our volunteers out of our health professionals who are at home, and we'll give them the first priority whenever we are mainstreaming. And then we will give them something, although they are volunteers, but we'll be prepared to give them something based on performance. So there are systems. There are IT systems we are putting in place to check. There are systems where people will go to the grounds to check whatever it is. And let me tell you this, just like any other policy, it will not be perfect. But then we'll take our time and gradually we'll get there. Thank you.